And I'm glad to welcome Bayo. I'm just seeing you for the first time.
Glad to see you too. Good morning,
So
Claire.
I'm really glad to have you back.
Thank you.
I hope you're strong, you're well.
Yes, I'm well.
Thank God.
Good morning, Kingsley. Good morning, Nigeria.
Right, Bayo, good to see you. Okay, let's take a look at the window page of the Leadership newspaper on Friday. The front page has a number of interesting stories. Let's go immediately below the nameplate. P&ID fraud. Court convicts. Winds up Marcourt Nigeria Limited. Court convicts and winds up Marcourt Nigeria Limited. Senatorial race. Falana faults APC over submission of Lawan and Akpabio's names. The list story has a double-decker headline and three riders that I can't dare Nigerians with a third term, President Muhammadu Buhari tells UK Prime Minister. Says the last person who tried it didn't end well. Rules out another bail for Kanu. And UK pledges military support against Boko Haram and terrorism. You can see the president there in Kigali, Rwanda, where Chogom, that's the Commonwealth Heads of Government meeting, is taking place. Ekweremadu and wife remanded in UK prison over alleged organ harvesting. And below that, you have this copy that, of course, has been trending since yesterday. Hijab, that's the kicker. Lawyer appears in herbalist attire at Supreme Court. Lawyer appears in herbalist attire at Supreme Court. Fuel scarcity. IPMA decries profiteering at private depots. Train attack. We are in hell over my husband's abduction. Wife cries out. Amotekun arrests suspected masterminds of a war attack and recovers weapons. Claire.
Very interesting storylines, and I think I have all those storylines, Kingsley, also on the front page of The Nation. So I'll just read out the ones that you didn't have. Just atop the nameplate of The Nation, gunmen demand 5 million naira ransom to free abducted DPO. Gunmen demand 5 million naira ransom to free abducted DPO. Now, 70,000 ghost workers flushed out of federal civil service. 70,000 ghost workers flushed out of federal civil service. And Ipman accuses depot owners of profiteering from fuel scarcity. And MTN, Mafab get August 24 deadline to roll out 5G. Now, defections, why senators and reps may lose seats, is also trending. And if you look closely, there's a story there. It says, I could not have rejected Atiku's running mate offer, says Okowa. It's on page 3. And detained Ekweremadu and wife risk 10-year jail in UK. And the other stories Kingsley also read on the front page. But again, for emphasis, Buhari on third term, the man who tried it did not end very well. Bayo.
Thank you, Claire. Let's start with the story about Senator Ike Ekweremadu and the wife Beatrice, who have now been remanded in a London prison till July 7th, when they are to appear in court again. They are facing allegation of conspiracy to facilitate the travel of a minor for organ transplanting. The Metropolitan Police that effected the arrest charged the couple to an Oxbridge court, where they were now remanded. The senator had written formally to the High Commission in Nigeria, indicating that they were traveling with a donor to the United Kingdom for the kidney donation for their daughter. Part of the arrangement was for the donor, after the process, to continue to live in the United Kingdom and also continue his education. However, when compatibility tests were conducted, it was found that the organs were not compatible, and the young man, wanting to continue to stay in the United Kingdom, is said to have raised an alarm, and that was the basis for which they were arrested. Currently, investigation by the Metropolitan Police have led to the fact that the donor whose age was registered as 21 has been found to be under 18, and therefore they are charging them with contacting and having a minor travel abroad for organ harvesting. Their next date in court will be July 7th. Meanwhile,
before you leave that story, I think we just touch on it so that because we have two topics to discuss today. This is the story that has been trending on the internet at various platforms with regard to what has happened to Senator Ike Ekweremadu and his wife. Now, the background to all of that, of course, it's something that every parent or all parents would seek to do. They are said to have a 21-year-old daughter who has kidney issues that will require transplant because she's been undergoing dialysis for a long time. You know, parents, of course, you want to save your own children, you want to save your own child, which has led to the chain of events that we just talked about. But I think that there are a number of issues to raise here without getting into the details, because I don't have access to the case file to say that, look, this is the proof of evidence. All of those will emerge in the course of the trial. But here we are. This is part of the risk of medical tourism that people always talk about. And secondly, it also raises the key issue that we've also been very worried about in Nigeria, namely that the law should be no respecter of persons. It should be no respecter of persons. That's the way it should be. That's when you say you have a law and order society. It means that if there is a prima facie case that you have broken the law, then the law enforcement agencies kick in. This is Metropolitan Police. It is not a Metropolitan Police. It is not the police chief in the UK who is taking on this matter.
Neither is it Scotland Yard.
It's not Scotland Yard. It's Metropolitan Police. They're taking up this case and they are prosecuting it. I'm not saying that. Of course, the two persons who have been charged are having their day in court and they will have the opportunity of defending themselves. But I just want to raise this issue, Claire and Bio. Yeah. Sometimes we don't look around sufficiently when we are pressed. Kidney transplant is almost being done routinely here in hospitals in Abuja. Kidney transplant. We have consultant nephrologists, some of whom have been guests on Good Morning Nigeria, and you go to their hospitals and they have top of the range facilities. And they would tell you, you know, there was a time, I don't know whether it's still popular, for Nigerians to go to India, get a kidney transplant, and then when they come back after some time, they develop complications.
No, why? Many even died during return flight from India.
Precisely, because what they say, yes, what the consultant nephrologist say is that post-transplant care is very important. So you have to keep visiting the hospital. You have to keep visiting the hospital over a period of time because your body has to accept. If there's, at the end of the day, there are all kinds of medications you take and tests that you run. If you don't have access to those things, complications will arise. And then your compatibility test is done. It's done, as I said, routinely here in Abuja. Anybody can find out. Look for any consultant nephrologist and they will tell you. I don't want to mention the names of some hospitals and persons who have undergone through that process. So this, I think that, as I said, when parents sometimes are desperate for solutions, they may not have access to the requisite information. At the next is say, look, let's go abroad, and there are rules.
You know, assuming also that he could afford to, you know, seek medical solution, yes, outside the country, agreed. But could he not also do or seek where he could conduct the compatibility test right here, even before going?
Yes.
That way you will prevent the issue of the boy wanting to remain, you know, and don't get yourself, because I think that is the basis of the problem.
Anyway, there's been a solution out for the current petrol crisis. The Independent Petroleum Marketers Association have now warned their members not to dare to sell petrol above 165 naira, the approved pump price. The president of the association, Chinedu Okoronko, says that the NNPC Limited says that there's enough petrol. And actually, they were acting on information from their members that had indicated that they were getting petrol in Lagos between 170 and 173 naira at depot, and therefore they couldn't have sold at 165. So we found out that petrol were available in stations, but because they were awaiting a formal announcement of increase in petrol price, they have not been selling. They have now found out that NNPC has insisted and petrol is being sold at double price at 143. Therefore, all of them should continue to sell at 165.
But there is scarcity still in federal capital territory.
The scarcity is because of the suspicion that there was an impending increase in pump price.
Well,
since
we do hope that there will be no further excuse. If you recall, Bayo, they were told that diesel wasn't available at some point. If you recall, we were told that depot operators are cheating the buyers and all of that. Let's find a way of streamlining all of this so that there isn't any confusion. I don't know whether you have details you want to let viewers know with regard to Amotekun arresting suspected masterminds.
Yes, the report there is very conflicting. Amotekun paraded 71 suspects they have arrested over a month ago. But the commander of Amotekun also gave a brief that they've been able to trace the vehicle that was used by the criminal when they left the church, because they had come on motorcycles and they hijacked a golf vehicle which they used as a getaway car. From the getaway car, they've been able to recover some arms, and they said they have made some arrests. But the police command in Nundu says it's not aware that there have been arrests of persons who committed the murder at the St. Francis Catholic Church. So, give or take, the Amotekun are saying that they have information and have made some arrests that could lead to the arrest of the murderers.
Well, that's the news of whoever has been arrested should be heartwarming, and recovery of illegal weapons and ammunition in the possession of those individuals. What is required is for Amotekun and the police authorities to harmonize their activities or their operations. I don't imagine that the police will be sitting on their hands on this matter. If such heinous crimes were committed, they should also be on the lookout in seeking to arrest who the perpetrators were. And once that is done, the next thing is to, of course, develop a case file and charge the persons to court.
Talking about arrests now, there was also an incident also in Ondo State, in Indari specifically. Armed robber invaded a house at 1 a.m. After robbing the couple of their items, the criminal insisted in raping the wife. The man summoned up courage and wrestled the armed robber and was able to raise alarm, and the armed robber was arrested.
That's a very brave man. I mean, it should be commended. Yes. Sometimes, is it because these things are happening too frequently, or that there is now greater media attention on isolated incidents? I mean, everywhere you turn virtually, you have all these stories of crime and robbery and kidnapping and beheading. You heard what happened in Anambra the other day, the second incident. I mean, what are these human trophy hunters? That the thing you would then do is to behead your victim after collecting ransom of 15 million naira. I mean, it's worrisome.
Just lastly, Babayo, should the story on Ekweremadu, should media continue to use organ harvest? Is it what it is, with the explanation you have just given?
Well, I don't want to comment further because it is something that is pending before a court. It's sub judice. It's safer to leave it until when all the facts are narrated in court and the court gives its verdict. Looking at both sides of the story, those are the information that is in the public domain.
Yeah, both sides, but deriving from the allegations. That's to say that the charges preferred by the
Metropolitan Police,
police of the UK. It is, the allegation is of child trafficking, that's to say trafficking a minor, for, according to the allegation, purposes of organ harvesting. I mean, it's not the typical organ harvesting you would say like Otokoto that happened in the 90s. This is to say, look, you're going to get a donor for kidney transplant. So all of the details, of course, will come out, and we hope that we have provided some ventilation. Once again, kidney transplant takes place here in Abuja.
In fact, they have charged them under what they describe as the modern slavery legislation state, which came into effect May 2022. That is the law under which they were charged.
All right, Bayo. Thank you.
Thank you.
There's other trending stories, but we can't take all of them, I guess. So, it's weekend.
Yes. Thank God it's Friday.
and we pray for a beautiful weekend. No uneventful weekend. Let me put it that way.
It should be an eventful weekend, I wish, but that's shouldn't be done. An eventful weekend, yes, to say happy weekend.
Yes, I agree with him, because we shouldn't allow criminals to hold us to ransom.
Absolutely. Could we constrict our space of
Okay.
the job?
All right. Have a good weekend. Bye.
You too.
This is Good Morning Nigeria. Don't go away. We'll be right back. All right, welcome. If you've just joined in, you're watching Good Morning Nigeria. I'm sure by now you know that the National Health Insurance Scheme has been upgraded. It's now the National Health Insurance Authority by virtue of the act signed into law by the President. And what that stipulates, that's what we had to find out. But first, let's listen to Ekene Ndulue's backgrounder to set the tone for our conversation.
Protecting people from the financial consequences of paying for health services out of their own pockets has remained a global issue, begging for actions from governments all over the world. Reports indicate that about 8 out of 10 Nigerians do not have a health insurance cover, with the majority of them paying cash if they have to visit a healthcare facility when sick. Tackling high incidence of poverty in the country caused by out-of-pocket expenses was why the federal government introduced the National Health Insurance Scheme in 2005. However, successes recorded by this scheme was limited, and since its launching in 2005, only about 5% of the Nigerian population was covered. For about 2 decades, industry professionals advocated amendment of the health insurance law, which they say was an impediment to the attainment of universal health coverage in Nigeria by 2030. Alas, President Muhammadu Buhari put pen to paper on the 19th of May 2022 to bring to force the National Health Insurance Authority Act 2022, which repeals the National Health Insurance Act, Cap N42, Laws of the Federation of Nigeria, 2004. At the signing of the new law, President Buhari pledged that a fund would be set up to ensure coverage of 83 million poor Nigerians who cannot afford to pay premiums for health care. By design, the new National Health Insurance Authority will collaborate with state government health insurance schemes to accredit primary and secondary health facilities and enroll Nigerians into the scheme in order to ensure delivery of quality health care. Sections 25 and 26 of the Act establish the Vulnerable Group Fund, indicating the various sources from which funding would be drawn. Funding will also be raised through health insurance levy, special intervention fund, investment returns, donations and gifts to the authority. What improvements does the new act bring to the health sector? Are there measures to ensure implementation will not be a problem? Guests on Good Morning Nigeria shall be speaking on these and other issues around the National Health Insurance Authority Act.
All right, the Director General of the National Health Insurance Authority is right here with us, Professor Mohammed Nasir Sambu. He's right here in the studio. Thank you very much for joining us.
Thank you very much for having me today.
We also have with us Dr. Gafar Alaudi, is expert in health financing, also right here in the studio with us. Good morning. Good to see you.
Good morning. Thanks for having me.
And part of this conversation is Dr. Ahmed Danfulani, his director, FCT Health Insurance Scheme. And is also vice chair of the Forum of CEOs of State Social Health Insurance Scheme. Dr. Danfulani, it's a pleasure to have you on the program this morning.
Thank you so much.
All right, so let's begin with the Director General of the National Health Insurance Authority, previously the Nigerian Health Insurance Scheme. Professor Sambo, the question arises, what's in the name? Scheme to authority. What's the difference?
Thank you very much, Kingsley, for having me again today in this very important station. From the name NHIS, National Health Insurance Scheme. Scheme is like a program which is being implemented. If you look at the word scheme, is connoting the fact that it's a program. But if you look at the word authority, even from the name, you see that the mandate is greater. So, deeply, the major issue is having an organization that will drive a mandatory social health insurance scheme. That is the NHIA. The NHIS law was not made mandatory, and therefore it limited the ability for health insurance to penetrate through all the nook and cranny of the population. But now with the signing into law of this National Health Insurance Authority Act, it has been made mandatory. So everybody now will now have to have evidence that he is under the health insurance arrangement. Whether you are in public sector, in a public, whether you are in a formal sector, in public arrangement, whether you are in private sector, whether you are in informal sector, and whether you are the vulnerable. So in the National Health Insurance Scheme, only people who are willing join the National Health Insurance system. But under the National Health Insurance Act, everybody, MDS, organized private sectors, multinational corporations, quasi-public organizations, non-governmental organizations will be compelled to join the health insurance. And the major question is, how can somebody who cannot afford 3 square meals will be able to join the scheme? So that's where the issue of when we go into the content of the law, you see that the law has made provision of what is called Vulnerable Group Funds, VGF. This fund is going to be populated from many sources, which we might probably discuss later, so that there will be funds to cover the vulnerable segment of the population. At the time when the president was signing the law, he made a pledge that government will populate that fund to cover 83 million poor people. Because prior to the signing into the law, there was a Lancet Commission report which suggested that about 83 million people in Nigeria are suffering from financial hardship of paying medical bills. So taking leave from that report, the president made an assertion for that. This is a very, very laudable achievement in the sense that for over 2 decades, effort was being made to ensure that this law is amended to make it mandatory, but to no avail. But now we have it. Other issues that are new in the National Health Insurance Scheme, apart from being mandatory, apart from also being able to have a fund that will be dedicated for those who cannot afford, it also has touched about issue that has to do with even looking at the operational guideline to ensure that health insurance agencies are also factored within the law of health insurance. If you look at the NHIS law, there was no mention of state health insurance agencies. Now this NHIS has legitimized the decentralization of the health insurance ecosystem by recognizing states as major actors. Then this is a very good omen in the operation, because what initially slowed the penetration of health insurance was the inability of state to embrace it at the national level. Now with the law legitimizing it, the state will have to go and also deepen the penetration of the social health insurance scheme. and the governors, maybe at the state level and at the local government, with this law, they will take the issue of implementation of social health insurance very seriously. The new law also has provided a clear instruction to the National Health Insurance Authority to be a promoter, to be a regulator, and to be an integrator of the health insurance ecosystem. If you look at the current system, the health insurance space is largely fragmented, and the whole essence of pooling of risk and pooling of the resources, which is the underpinning principle of the social health insurance scheme, is lost along the way. So you have many non-governmental organizations driving multiple social health insurance schemes. The environment is a little bit chaotic, and it can hardly be coordinated under the health insurance law. But now the Health Insurance Authority is empowered to be able to take this role of regulation very seriously. So it will entail a thorough amendment of the operational guideline to ensure that all those provisions are met.
I really, when we talk about NHI, it's, I'm very emotional about it, and that's because of what it seeks to address, especially with regards to out-of-pocket expenses. And if you consider the fact that for, over 20 years, it's been in operation, the penetration has also not been able to, it's still quite restricted. I'm wondering how the authority, hopes to, now that you have such an expanded, mandate, how you hope to achieve the 83, reach the 83 million people, which is the target of this act.
This is very simple, because the structures are on ground to be able to deliver it. Before now, we've been in this station, and we have talked about Basic Healthcare Provision Fund, which is an arrangement that 1% of the federal government fund is coming to the national health system. 50% of that fund is coming to the National Health Insurance Scheme. And the mechanism of delivery of that fund was through the state structure, because states are closer to people and they can enroll the people very clearly. So the guideline of the Basic Health Provision Fund, though the law is, the fund is national, is from the federal government account, but it was going to the state for the delivery. That is why, in fact, that was the catalyst of the development of state health insurance agencies in many states. Up till today, some of the states are not even doing the formal sector social health insurance, but they are being given funds to do this vulnerable fund. So the basic health, the vulnerable fund, the 83 million population, is not going to be delivered at the level of the federal government. The money will be channeled to the state, strengthen the state health insurance agencies, and the state health insurance agencies will enroll this vulnerable segment. It will be very difficult for the National Health Insurance Scheme at the center to go to all the nook and cranny of the population. So that is why this law recognizes the decentralization. But the aggregation of all the funds, and to have a very watertight mechanism whereby the fund will move from the National Health Insurance Authority to the State Health Insurance Authority, and we are working assiduously with international partners, at least African Budget Network, to develop what is called accountability framework, so that every kobo that has moved, that has come to the National Health Insurance and has moved to the state will be tracked and ensure that it is efficiently utilized. So in a nutshell, this vulnerable fund, as provided by the law, is not going to be driven by the National Health Insurance Authority at the center, but the money will be deployed to the state for the purpose of the coverage. Already, this activity is going on with the Basic Healthcare Provision Fund. If you do an assessment of state health, the health insurance system as it is today, the Basic Healthcare Provision Fund is on ground, and many people have been enrolled and they are enjoying services. But now that is now mandatory, more and more supervision will be required to ensure that money is there is value for money for every kobo that has been deployed.
All right, thank you very much, Professor Mohammed Sambo. We'll return to him in the course of the conversation. Now, let's bring in Dr. Gafar Alaude, who is an expert in health financing. From your perspective, how much of a game changer does the Health Insurance Authority Act promise?
Okay, thank you very much. I think to start with, let's look at the big picture, which Prof has already alluded to some of them. I think the big picture, which is the global outlook, the global policy trust in the health sector today, is the universal health coverage, which means everybody, irrespective of your circumstance, you should be able to have access to needed health care without suffering financial hardship. And globally, there are two conditions for achieving that. One condition is health insurance must be mandatory, in the sense that, you know, because the lining principle of health insurance, like Prof said, is cross-subsidization. That means the rich will cross-subsidize the poor, the healthy will cross-subsidize the sick, and probably those that are not in productive bracket of age will be subsidized by those that are really working. So, and the second condition is the subsidization, like he said. Even when we say health insurance premium is 1,000 naira today, there are some people that are not able to afford it. So how do we ensure that those are not left behind? So those are what they call conditions for universality, and those conditions are already there in the new legal framework. That's why some of us are very, very excited. And one analogy that I would like to draw to that is that if you want to move a car from point A to point B, three things are very, very important. One is the functioning car itself. Number two is the fuel you are going to put it. And number three is the competent driver that is going to drive. So looking at what the legal framework is in place now, in terms of the fueling, in terms of the structure, in terms of the vehicle itself, so we have the national health insurance at the national level. We have the state-supported health insurance scheme. And other private organizations like third-party organizations that are working with health insurance and HMOs as well. Then the critical component, which is the money, in terms of subsidizing people that are not there. So the voluntary group fund is there. And what is now very, very important, and the Prof has done a very, very great job in terms of calling the partners together, say, please come and help me in terms of how do we operationalize this. We have seen a lot of legal framework in Nigeria that remain on the shelf and nobody touched them. So what is going to be different is that what do we need to do to operationalize the legal framework to ensure the driver, the vehicle, and the fuel are in place and are working together. I think one of such a thing that is very, very important is to look at, we have Mr. President talk about 83 million, which is backed by evidence in terms of people that are not able to afford it. If I was to do some costing, if you want to cover these people, of course the covering will not be overnight. How much do we need? And from the voluntary group fund, vulnerable group fund that we have, there are different elements to look at where would the money come from. But at the same time, who do we need to engage to ensure the money comes out? Because we have learned a lot of lessons from the Basic Care Provision Fund, from the state health insurance scheme. I will give you an example of a state that has the state health insurance scheme, and part of the component is the equity fund, which is meant to provide health insurance coverage for the poor people. Then we engage the Ministry of Finance, which is supposed to bring out the money, because it's not the health insurance agency that's going to collect and spend the money. Ministry of Finance had the responsibility. And in that particular state, we engaged the Ministry of Finance that, how about this equity fund? They said, which equity fund are you talking about? We said, the equity fund that is in so law. We said, which law are you talking about? We are not aware of any laws. So it is very, very important for different organizations and agencies to come together to form a partnership and collaboration to ensure that we clearly understand the content of this legal framework, understand issues around this, even understand where some people might have issues with the legal framework, looking at the political economy of it, looking at the influence and interests of actors and institutions, and how does it affect this. I think all these elements are very, very critical because the legal framework is very, very promising. Some of us have done assessment. Why is it that in Ghana that started the same health insurance with Nigeria in the same year, Ghana has almost covered half of the population. Nigeria is struggling with only like 5% or thereabout. But 3 things came out clearly, and 2 are from the legal framework. 1, the legal framework does not make it mandatory and does not make provision for, what do you call it now, pool of fund. But the 3rd element was that the way health insurance was conceived many years back, it was conceived as a centralized entity in a politically decentralized setting like Nigeria. So that was what gave rise to decentralizing the health insurance. That's why we have state health insurance like Dr. Fulani heading the FCT1. So I think all of us need to come together to look at how to support the National Health Insurance Authority to fully operationalize this legal framework.
I know you are the expert. I want you to break it down for us. When we now say, by reason of this act, health insurance is now mandatory, what does it mean to the Nigerian? To those in the informal sector, what does it mean?
Okay, so good question. So if you look at the population segmentation, we have the formal sector, informal sector. Within the formal, we have the formal private and formal public. Formal private are people that do government, ministry, department, and agency. Formal are private, like people that work in bank, NGO, and international organization as well. So if you look at that category to start with, if you say the health insurance is not mandatory, so I have the option whether to join or not to join. And if I decide to join, I can join a private health insurance, which is a pool of health insurance for the elite, so to say, because it's a private health insurance. The pool of money cannot be used for the poor people, that part of this 83 million we are talking about. But when you say health insurance is now mandatory, so according to the law, if just like pension scheme and some other scheme that says if you have up to so number of employees, is now mandatory for you by law to get health insurance for your people. So if you do that, that means we have a lot of elites that are buoyant, that can pay for health insurance, and then they are required, even if they will get private health insurance, they must get the social health insurance, which is a common government one as well, which the money will enter the pool that could be accessed by even the poor and the vulnerable as well. Then when you now come to the informal sector as well, okay, so in the informal sector, is broadly divided to the formal sector poor and formal sector non-poor. And that is where the bulk of the poor people are. So for the poor people that are not, it's mandatory for them to register as well. But it will be coupled with they will be held by the subsidization because they are not able to pay. So what do you do? So by making it mandatory for everybody, irrespective of the class that you belong to, you are expected by law to do that. And it's not something entirely new. Like I said, we have the pension scheme, which is mandatory for certain entities and all the stuff like that. But what is extremely important is to have the money to subsidize people, because it's very difficult to implement mandatory participation without the subsidization element of it. So that subsidization is very, very key, it's very, very central. But part of the advantage of the mandatory participation is that there are some people that are able to pay, and this mandatory participation will ensure they actually pay and they contribute to the pool.
All right, thank you very much, Dr. Olawode. Now, Dr. Ahmed Danfulani, you are, of course, in charge of the FCT Health Insurance Scheme. What does this act mean now for state health insurance schemes and, of course, the FCT Health Insurance Scheme?
Yeah, thank you very much. For us, in the State Social Health Insurance Scheme, First and foremost, we are very excited with this act. We are very, very excited because this is the first time a law in Nigeria puts together all the various stakeholders in health insurance ecosystem. This is the first time in Nigeria where the state social health insurance scheme are mentioned in the national legal document. So that makes it clear that we are already having an authority that is speaking to all the different stakeholders in the health insurance ecosystem. And not only that, the various descriptions of participation of the different stakeholders is also well stated. And for the first time, you see clear regulatory rule of the NHIA, especially on the state social health insurance scheme, on the private HMOs and TPA and all other NGOs that are in the health insurance ecosystem. So this law is an all-encompassing document that has brought together all the various, stakeholders in the health insurance landscape. And we're very happy about this because it also gives credence to what we are doing under the health insurance under one roof. And I must also commend the DG NHIA in his proactive and leadership style that has already seen these various stakeholders coming together to achieve a lot of things. I must tell you that just recently, the NHI has facilitated the trips for the state social health insurance leadership to even visit Rwanda. This is wonderful. It's already showing the collective nature of the health insurance activities in Nigeria. Number two, we are also excited about the mandatory nature of this scheme. We have said it times without number. It's not very easy to go onto the street and walk up to a man who is well, is walking about, and you ask him to come and pay for health. It's very difficult. Some of them will even go spiritual. Some of them will go religious. That are you praying to God that I should fall sick? Why should I come and pay for something that I don't need at present? But now with this law, all of that is history. And under that mandatory nature now, an employee will have the right to ask the employer that I am supposed to be registered under a health insurance scheme. And so it becomes mandatory on all employers to enroll all their employees under the mandatory health insurance scheme. This is also very important. And I'm sure by way of proper implementation strategy, this is going to lead to a very huge amount of people joining the health insurance. Now, Dr. Alawadi also talked about the input from the private enrollees, those that join the private health insurance. This law has clearly stated that it is not enough for you to buy a private health insurance, but it's also important and mandatory for you to also contribute into the larger pool of the state social health insurance scheme. This way, you are also contributing to the pool. In the past,
is that a new tax?
No, it's not a new tax. In fact, it means that the package you are buying from your private HMO, we include you getting a social health insurance scheme. And what you are now paying to the private HMO is what we call a top-up for services that maybe are not available under the social health insurance scheme. So that is a top-up for you. And so you can get all the basic services that you needed under the primary care services in the social health insurance scheme. However, you may need more than that, which is obvious. There are certain things that may not be covered under the state social health insurance scheme that are covered under the private scheme. So that's what you pay as an additional to the private HMO. So that is also very exciting to us because it means that everybody, every resident, whether you are in Nigeria, whether you are not a non-Nigerian, you must contribute to the pool of the health insurance in Nigeria. And also it reminds me of what some of us go through if you want to travel out of this country, especially to this European country. You buy health insurance packages. Without that, they will not issue a visa. It's important to note that some of the money we are using to buy these insurance packages is more than enough to pay for the social health insurance scheme in Nigeria. In other words, the cost of buying this the travel health insurance is far, far more than what we are charging at the state social health insurance scheme.
So when you say that non-Nigerians, let's say visitors to Nigeria, will also be required to make a contribution to the health insurance fund, Is there, Prof, you are itching to say something, but is there a requirement in the law, the details of which I must admit I haven't interrogated, is there a requirement of the law for the immigration to say, look, if any person is traveling to Nigeria from outside, before we issue you a visa to Nigeria, take a health insurance?
Well, presently, it is not clearly stated. I just use that as an example, that as we as Nigerians and many other nationals of other countries, if you are traveling to some of these countries that have their established health insurance program, you are required, it's mandatory. If you don't buy those health insurance of those states, you will not be allowed to enter, you will not be given a visa. But this is not clearly stated in the current act we have. It's not clearly stated. But what is clearly stated is that most other nationals, you know, maybe working in different multinationals, oil companies and all of that, that hitherto don't buy into the local health insurance scheme. It's now mandatory for them. For example, some of them even have international health insurance card, which is what they use to take care of their health insurance. Now they have to buy into the national health insurance program. They have to pay to the pool, you know, no matter what they are. If they like, they can get any kind of international health insurance, but they must pay to the pool. Now, thirdly, the state social health insurance scheme, we're also excited about the fund. We are very excited. It clearly shows the interest of the federal government in the poor and vulnerable. If we are talking about universal health coverage, and we are not planning for subsidy, we are not planning for the poor and vulnerable, we are wasting time. A lot of statistics have shown that majority of Nigerians, they fall under the poor and vulnerable. And so the people that can probably pay for themselves may not be more than 20 to 25%. So where do you leave the 80%? And in the wisdom of the National Assembly, in the wisdom of the National Health Insurance Scheme, they have thought of this very important, you know, fund. The vulnerable fund is a very, very good innovation. And I'm also happy that Mr. President has committed to funding this particular program. And so we'll be seeing huge number of people under the poor and vulnerable scheme coming onto the health insurance scheme. If we don't do that, it's going to be almost impossible to attain the universal health coverage.
Precisely. Dr. Ahmed Danfulani, thank you. And that's from where I'm going to ask my question, Professor Samuel. Every other person seems to have obtained a cover, a health insurance cover. We now have the Vulnerable Group Fund. Those who are not employed, the poor, the indigent, you know, the elderly, the children and all that, how does this fund, how does it cover them? How can they access, you know, the services of that fund?
Thank you, Madam. These are the vulnerables. And these are the people that will benefit from the Vulnerable Group Funds.
Yes, how?
Okay, simple. You are talking about strategy, or now the fund is available. Yes. Assume that the fund is now available, and now what is the mechanism in place that will do to cover them? Before I answer that, I know Kingsley is a lawyer as well, and if you look at law, sometimes it mustn't expressly state what everything should be. Regarding to the, it could be implied. So if you look at the law, it says that every Nigerian and any legal resident. So if you come from abroad, you are to spend 1 week, you are a legal resident because you have a valid documents to stay. You have to obtain health insurance. So that section is implying that even if you are coming to Nigeria, you will buy health insurance. And this we are going to explain it clearly in the guideline, because we are currently working with all the partners to ensure that we look at the law and see how it can be operationalized. And one critical thing is to ensure that there is a comprehensive guideline that will cross all the T's and dot all the I's without leaving anything without explanation. So it implied. Coming to your question, I made mention of the fact that the government will aggregate the fund through the various sources, including the tax that Kingsley will not want to hear. But okay, I know it will come, and I know you might not want to hear it, but tax is not a crime. If you are taxing people to improve their lives. Most of the developed countries develop their societies and maintain their society through taxations. So I don't think we should have a phobia for taxation. What we should call for, if there is taxation, there must be efficient utilization of it so that everybody will benefit. So maybe I have answered this question in prospect. The mechanism is the fund will be aggregated through the various means. The money will be channeled to the states. If you will go to the Ministry of Humanitarian, they have a database of people that are poor. In fact, it started with in the office of the Vice President, the NASCO, National Social Security Register. Is available. It is a very comprehensive document that has gone to every nook and cranny of Nigeria to generate data based on evidence of people that are poor. So the National Health Insurance in collaboration, Authority in collaboration with the state is already partnering with the NASCO so that we can utilize their register after validation by the state to ensure that people are registered. And one of the things that we have done in the National Health Insurance Scheme, which I have mentioned in one of our programs, is deployment of digital technology to drive the health insurance ecosystem. Part of what we are doing, we have what we call NIMC integration. The National Health Insurance ICT platform now, if you register, it has capacity to generate a NIN number for you. And if you have a NIN number, you come to the National Health Insurance Authority, you will have that NIN number reflected. Because that NIN number is very, very critical to ensure that there is no duplication. In fact, in some of the countries, going through the NIN, everything that you will do, including your own family enrolling into the school and so on, you must have a NIN number. So pressing your NIN, all information about you will be obtained. So we have collaborated and we have integrated our digital technology system with NIMC so that there will be no duplication. Because one of the things that you want to avoid in the process of implementation is try to avoid as much as possible duplication, multiple register. So the state health insurance agencies will be working with the register that is developed collectively under that NASCO, and that register will be utilized to register households who are poor and be issued an identity card, and also get the designated healthcare facilities at the primary care level when they are sick, just the way we do the basic healthcare provision. So essentially, this coverage of 83 million, we are going to utilize the state structure, and already we have this NASCO register, which has the population of the vulnerable segment of the population to register. So it will be seamless. Once the money is available, we'll just swing into enrollment. And NHIA already has given what is called application program interface, because there is minimum ICT requirement to ensure interoperability. So all the states are now developing their ICT framework that will allow NHIS to properly integrate the system.
Let me also justify a bit. I want to ask you, do you have confidence in the state structure? And this is the reason for my question. Yes. The implementation of the 2030 goals, the SDGs, is also based on state structure. And we all know where we are with regards to the individual indices, health indices. We know we are yet to even meet our target using the state structure. Now you're also going to use those same structure, to implement this service scheme. Are you confident that we're going to achieve our target?
If I say I am not confident in state structure, then I have no confidence in Nigeria as well, because there are structures that are with us, and there's nothing we can do.
Because we'll get the same result.
Not really. That's why that's why I told you that in our implementation strategy, Gafar will tell you that just 2 days ago, we had a very robust engagement with international partners. And in 2 weeks' time, we are going to have a very robust engagement with the state agencies. Health insurance is a system whereby people are making contributions and people will demand for their rights. And every actor in the health insurance will have to be conscious of that. And and what is important is to what extent do we have an accountability framework that will be able to checkmate all the negative tendencies that will be coming. I think we should emphasize, rather than to be frustrated with our structure, we should work towards ensuring that, yes, when I came to the National Health Insurance Scheme, everybody has lost confidence. When I came, the state agencies, the partners were not working with the National Health Insurance Scheme. And go and see the ecosystem now. Because of the confidence that people have the confidence that we have restored in the system, all the actors have come. In fact, that is one of the critical success factors to get this mandatory law into signed by Mr. President. Because what used to happen before, the system was so fragmented, everybody was pursuing his own interest. Even when the National Assembly passed the law, some people will go and ensure that the law is aborted. But because of the stability we have been able to ensure through what you call health insurance under our concept, where we bring everybody, every decision that we take, we ensure that we involve people and it will be diplomatically accepted. Now we have stability, and that's the kind of system that we will employ to ensure that if you are an actor in the health insurance ecosystem, you play the rule according to the game.
Professor Sambo, I'm tempted to ask you this question, but it will also go to Gafar and Danfulani. And the question relates to process and procedure. Who is eligible to be enrolled in the health insurance operations? And how do you go about it?
Every Nigerian, with the National Health Insurance Authority Act, every Nigerian is eligible to join the National Health Insurance. How we are able to go about it is we are not developing anything new, but rather strengthening the existing arrangement. For example, at the national level, we have a formal sector social health insurance program, which every employee of organization up to 5 and above is supposed to join. And before it was not a mandatory. So if you like, you will not come. Now it is mandatory. You cannot do business in Nigeria now if you are an organization without having evidence of health insurance coverage for your people. So those people at the national level, the NHIA will continue to expand the formal sector program at the national level. The state health insurance agencies will expand the social health insurance for formal sector at the state level and the local government. So all employees of the state and local government and the employees of the organized private sector that are localized within the state will join the state social health insurance program. Then for the informal sector who are self-employed, there is a gift ship program which we have discussed it in one of the sessions here after the Honorable Minister of Health has launched the program. We have this group individual family social health insurance program which we have developed. So an individual, family and group like associations, they can come and join the National Health Insurance Scheme already is in existence. We have similar thing. The state are also developing those gift shift programs to be able to take the informal sector at the state level. then the vulnerable segment of the population. These are the people that have no coverage, and this is why we have this vulnerable group fund. So now, with the existing structures we have programs that will answer to every segment of the population. The thing is now, how do we catalyze, how do we strategize to ensure that everybody comes on board? And this is what we are discussing with all the partners and the stakeholders.
Dr. Gafar, speak more to this issue regarding process and procedure. Because Professor Sambo says, yes, join the health change insurance scheme at national or at state level. How does, for instance, a self-employed individual who is in the informal sector say, look, I want to join the health, what steps should that person take? Where should he go to?
Oh, okay, thank you very much. Probably before I answer that question, so there was this question around whether or not the existing system will work, working with the state structure and everything. And I want to provide evidence that we are seeing evidence that it is already working. Don't forget that Prof said Basic Care Provision Fund has actually started. And what this law we do is to expand the pool of people that benefit from it and as well. So in terms of those people that are already benefiting from Basic Care Provision Fund, so we did a little study to look at, go to the facility level and look at those people that are on Basic Care Provision Fund and compare them with people that are not insured and held in insurance as well. So the standard to show that the financial barrier has been removed is the number of times you are able to visit health facility in a year. The minimum, if there is no financial barrier, is that you should be able to visit facility at least 4 times in a year, whether for checkup, whether for preventive care, curative care, and all those stuff. Among people that are not on any form of health insurance at all in Nigeria, they visit facility less than once in a year because of financial barrier. In fact, the thought of how much will I pay there, where will the money come from, can even prevent you from going. And we look at those that are on Basic Care Provision Fund. On average, at least they are visiting like 2 to 3 times, which is a significant improvement that we have seen over time. So what this law will do now is to expand the pool of people that will be benefiting from that. That means with that, many people will be attending antenatal care. Many people will be delivering in health facility. Why do women die during, most of the women that die during pregnancy and childbirth, they die around delivery period because they don't deliver in health facility. And one of the main reasons, not all the reasons anyway, is because of I don't have the money to pay at the health facility. And if you're on health insurance, you not think of that. You deliver in health facility, and if there's going to be any emergency, for example, postpartum, hemorrhage and everything, it will be taken care of. So it's already working. I think, so I want you to have the confidence in the system. And what is very important now is to expand the pool of people that will benefit from it. Coming back to your question in terms of individual people, I'm very happy Danfulani is here in terms of those people managing health insurance, whatever. On their own, they even do serious marketing in terms of engaging different individuals, group of people, because, you have to convince people. Not many people know about health insurance. Not people know about the benefit of health insurance. And it's very difficult to convince people to pay for what they might not need immediately. So strong community sensitization is very important. Engagement is very important. But at the same time, what is even more important is the experience of people that are already enrolled. Because the best marketer of insurance is people that are already insured and say, okay, I am on health insurance, I have this ailment, I went to the health facility, I did not pay, and I was able to get the care. I think that's very good. But beyond that, a lot of interpersonal communication, a lot of mass media, and the media has a role to play. It's very, very important in terms of bringing people to the pool.
You know why I'm asking this question, Dr. Danfulani?
Yes, sir.
Look, break it down for our viewers. Is the health insurance stuff like, say, your vehicle insurance? You go to various locations, for instance, around either the road safety offices or more particularly with the one you have in Mabushi there, you have persons who are hawking, literally, automobile insurance. They call it third party. Now, that's why I'm asking, where does the individual go to, or from whom should he accept, or should she accept product marketing? Are you going to, is it that the officers of your scheme, for instance, in the FCT, will be the ones who are canvassing prospective clients? Is it a brokerage firm that we are going to use, or is an established health insurance firm?
Yes, thank you very much. Before I go to that, so please kindly permit me to say something about the state's capability to drive the health insurance. You will notice that the first comment I made about this new act is that we now have a system, we now have an ecosystem that is being effectively headed by a leader. And that transmits to all of us the quality of leadership and the functions of every stakeholder in that leadership. Not because he's here, I want to say that since the DG assumed office at the National Health Insurance Scheme, a lot of things have changed. For me, I was more than 2 years in office and I didn't have anything to do with the NHIS. But as soon as he came, there's these collaborations with everybody, all the stakeholders. Many of the things we do now, they are structured and they are guidelines from the National Health Insurance Authority that drives some of the activities that the state are doing, and it's working. The results are already coming. The DG will agree with me that within a year of bringing everybody on board, the total enrollment in Nigeria almost doubled. Within a year, he will tell you. Because the small structures in the state, they are bringing enrollment into the system. And so we are already seeing that. And to even say that a lot of states did not have state social health insurance scheme until the coming of the Basic Health Care Provision Fund. And that has been the catalyst for setting up those state social health insurance scheme. So in addition to for them to do the basic health care, they have their own state program now. So it's already working. And I'm sure the only way forward is to continue the way we are going, activities from the central regular supervision MI. I'm sure we're going to get there. Now, on the area of, how we enroll our people, we have systems. First and foremost, we all agree that health insurance is still very new in this country. A lot of people still don't know how it operates. So we are doing a lot of sensitization. For some of you that are in FCT, you've seen that even FCT insurance is trying to do a lot of sensitization to let people know about this. Now, you can enroll by physically visiting the various offices and enroll yourself. Or you can use the ICT platform, online enrollment platform, that can bring you up onto the scheme, and you get your card, and then you're already on the system.
Remember, we're also including the vulnerable groups as well. Those groups who probably can't read, can't access the digital platforms and all that. But just get a final contribution from the DG. Talk to us about the premium, and would it be such that would also address the issue of quality service? That's one. And we understand that this act has also conscripted the role of the HMOs and expanded more administrators in this. Can you talk to us about this?
Okay, you see, the premium in health insurance is never static. It is the political economy has a lot to do with what the premium should be. And I have mentioned it repeatedly that the amount of money that you have gathered is what you are buying. You are going to a market, a health market, to buy health insurance for people. So if you have large amount of money, you can buy the whole package of health insurance. If you contribute small amount of money, you buy the amount of services that money can buy. That is one of the principles of the social health insurance. As it is today, with the Basic Healthcare Provision Fund and with the formal sector program in the National Health Insurance Authority, we have what we call a benefit package, which is costed. And for the group individual family social program, we are paying individual group and family are paying a premium of average of 15,000 naira per annum to get the services. You will wonder how 15,000 naira will be able to cover healthcare challenge for an individual. That is the whole rationale for the health insurance. Many people bring their money and you put them together. You have a woman that is pregnant and she has visited her doctor and he said that you are going to have a cesarean section. Ordinarily, the cost is 150,000. But because you have the pool of health insurance, that woman can undergo cesarean section without paying anything. And that's why you can hardly see people that have gone into the social health insurance scheme, and they, just like Gafar has said, experience matters a lot. Even if you say health insurance is not good, the women that have gone, the family that have gone and have a cesarean section at no kobo will tell you that this program is good. So this is one. We will
you just have 60 seconds, DG.
Okay, so you will have a benefit package. We will continue to drive our benefit package. If we are able to...
What is in that benefit package? Because you talked about, I mean, you started the example of cesarean CS.
Yes.
CS, of course, is usually a very costly thing for pregnant women. Everybody's not pregnant.
Yes.
So what is in the content of that basic package?
We have discussed this thing. We have developed the benefit package. We have put it in our website for the past 2 years. And we have mentioned the fact that everybody can go and download. We have hard copies. We have the soft copy. You download it when you are going to hospital. You will see the range of services. Almost every services that is taken care of at primary care level. Almost all the services at the secondary care level. And services that are at tertiary level, with some exclusions.
Professor Mohammed Nasir Samba, I'm afraid and I'm sorry I have to stop you at this point because we have a second issue that we must take. Professor Mohammed Nasir Samba is the Director General, National Health Insurance Authority, formerly National Health Insurance Scheme. Of course, it's been explaining to us the new act and what it seeks to provide, the services it seeks to provide. Thank you very much.
Thank you very much
for joining us. Let me also appreciate Dr. Gafar Alawade, who is an expert in health finance, and indeed, thank you for all the explanations that you were able to give us.
Thank you.
Dr. Ahmed Danfulani, Director, FCT Health Insurance Scheme, and of course, Vice Chairman, Forum of CEOs of State Health Insurance Scheme. They still remain as schemes, right? Okay. Thank you very much for joining us. All right. This is Good Morning Nigeria, and we'll be right back.
You're watching Good Morning Nigeria live on the network service of the Nigerian Television Authority. Now, the Organization of Youth in International Trade and Commerce is partnering with the NTA Television Enterprises Limited for a business expo that is expected to take place in Houston, Texas. To tell us more about this collaboration, we have two guests with us in the studios. Let's welcome Chinedu Amadi, who is President, the Organization of Youth in International Trade and Commerce. Chinedu Amadi, we are glad to have you here this morning.
Good morning, thank you.
Right. And also here with us in the studios is Chinwe Osuji, who is the Chief Legal Officer of the NTA Television Enterprises Limited. Chinwe, a lawyer, pleasure to have you this morning.
Thank you very much.
All right. Claire?
Yeah, Kingsley. So let's start with Chinedu Amadi, who is the president of the organization, and it's Youth in International Trade and Commerce.
Thank you. OYITC.
Yes. Tell us a bit about this. What exactly do you do?
Okay, the Organization of Youth in International Trade and Commerce, OYITC, is an umbrella organization that looks at young entrepreneurs and women who are interested in non-oil export trade. We help them to expose their products and services to the international market. That's our primary goal. And as we all understand, Nigeria is dependent on crude oil as its major earner. And there is a need to change that to dependence on other areas of revenue generation, and non-oil export trade is a very important aspect of that. We've seen non-oil export trade grow, especially during COVID-19, to a very significant number in terms of the internal revenue generation of Nigeria. And our target is to move that trade. It moved from about 400 billion to about 1.8 trillion naira. And our target is to move that from the current 13% that is sitting to about 30% in 5 years. So what we're doing is engaging on young entrepreneurs, engaging with women who are in trade to help them expand their capacity and also get their products to the international market.
What are the core services, I imagine, and products that your members deal in for purposes of export?
Okay, so primarily agro-allied products, garments, and leather products. Then other services, arts, and the rest. But these are products that has nothing to do with crude oil,
Oil and gas.
What again? I mean, explain. What are your channels for accessing the international market? I do know, and there have been reports around this, that there were some frustrations that exporters experienced at the ports, and I think that a new shed, if you may, has now been created to enable exporters use that particular route without getting into a logjam in the typical customs or port authority areas. What is your experience with this in terms of your members?
Okay, so one of the things we are doing is working with the different agencies. For instance, Federation of Agri-Commodity Association of Nigeria. They are part of our organization. They are in collaboration with us. So all products that have been listed and approved for export, you understand, we look at that and discuss with our members. So first, they already know the products to work on. Second, the second channel is through trade exhibitions to share with the world what we produce, and then invite potential investors, invite potential off-takers and vendors to come in and look at those products, and then it becomes much easier. Of course, we're looking at the export process through shipping, and the federal government is also making it even much easier. There is a new terminal in Ikorodu, Lagos, solely for non-oil export trade. So that is part of the workings that the government is putting in place to ensure that there's smooth transition of goods and products from Nigeria abroad.
What form of help? Because you say we help. What form is this help coming? And you also have an expo coming up, which is the basis for the collaboration with the NTA, yes. Which you say it's coming up in Texas. Yes. Why Texas?
Okay, so let's even look at the first question. First, the challenges with our products. We have good products, but design, packaging, and branding is one of the key challenges. And so what we do is first train our members on product design, packaging, and branding to ensure that it meets international standard. And so we'll talk to them about ensuring that standards are kept, because once people start production, at times they want to rush, and that little bit of lack of patience could really impact the quality of products. So being consistent with products is very key, you understand? So for other organizations, especially the regulatory agencies like NAFDAC, we also guide them, we help them to assess and go through NAFDAC processes much easily. So now, to the next question of...
And you don't provide the market as well?
We expose them to the market. We are working with some of the e-commerce platforms like ebosi.com. where they go and list their product, and that's an international platform for them to expose their products. Understand? But also we are engaging with, and this now takes us to Houston proper. Why Houston? The Nigerian community in Houston is growing significantly. In fact, we can take it that it's the second largest community in Houston, in Texas, so the Nigerian community. And the market is growing very tremendously. Back in 2009, in Houston, you can look at about 5 or 6 African stores. Today, those stores have grown to about 85 and counting. And most of them were triggered during COVID-19. So a lot of people, got busy, ideas came up, and some are running their products even in their garages. So there's a huge demand for Nigerian products. There's a huge consumption of Nigerian products. The Americans and African Americans are consuming our products. Our food, our rice, our plantain, our clothes, our music is actually, for the music and entertainment, is just like it's taken over.
Yeah, so we'll get into the Booga aspect,
Yes.
maybe at some other point. Chinwe Osuji, let's bring you in here. I mean, it's somewhat interesting. We are trying to promote non-oil exports, and we've chosen Houston, which is very well renowned for oil summits, oil expos, and oil exhibitions. But I mean, give us some more insight into this forthcoming expo in Houston. Is it a sole expo by the organization, or the organization is part of a larger expo?
Okay, thank you very much. It's part of a larger expo in the sense that there are several collaborations, which NTA Television Enterprises is one of the collaborators. In fact, a major collaborator. Because looking at our own mandates, we pay much premium on idea generation. And what OYITC brought to TVE is very promising, and that is why we keyed into it. And looking at Nigerian Television Authority, and by extension Television Enterprises, it pays much interest in trying to promote all that can really bring together the nation, national integration. We're talking of national development, and this is one of them, especially when it comes to youth development, which this project is all about, showcasing the productivity and creativity of young people and the women. That is why we keyed into it. So it's going to be big, and we are looking forward to all the activities lined up for this event.
What kind of role will NTA be playing?
Okay, the role we are playing, of course, we're already on it now. We are talking about publicity. That is one of the things we're doing. And we're looking at youth empowerment, which is a major thing for us. And we are all out looking at these youth, their zeal and everything. And we are ready to support them. That is why we're into it. We are also looking at is a viable, very viable venture for all concerned. In fact, it's a win-win for everybody. Both the collaborators, the participants, the youth involved, the women, everybody will come back smiling, because they will have the opportunity to network and learn. Many people will speak to them. There will be seminars, there will be exhibitions, and networking, that will take place, and they will learn from all these things. Mr. Chinedu had already mentioned about helping them in branding their products. These are things they will take out with them. Even after this project, they will still move on with that.
When is the expo in Houston?
Okay, so the expo is lined up from July 25 to July 30th. We arrive Houston on July 25. We start on July 26. So it's a 4-day event, and we start, the first day will be discussions, seminars, regulatory agencies looking at challenges of non-oil export trade. Then 2 days for the exhibition proper. We look at agro-allied, we look at so all the various products produced here, made in Nigeria. Then the 3rd day we'll be looking at the garment and leather, bags, our shoes, our clothes, our fashion, part of course our entertainment. Then the 4th day we'll be having a gala night where we all have fun, and there we showcase Nigeria.
Yeah, what is the role of MITI, that's the Ministry of Industrial Trade and Investment, or the Export Promotion Council, or is it Commission now?
Okay, so yes, we've had several stakeholders forum, workshops with various regulatory agencies, major partners, and they are very well informed. They are attending the trade show, and of course they're also lined up to make country presentation on export promotions and investment into Nigeria. So yes, they will be there with us, and we hope to have, as we continue to plan for the other trade shows that will be coming up after this.
Who is sponsoring this expo now?
Yes, in terms of sponsorship, first the participants are sponsoring themselves, very key. We've also called for sponsorship. There are commercial banks that have lined up to sponsor a trade show. Also, we are also calling on the federal government, of course, to continue to support us through NTA to sponsor the trade show.
You see, I just asked you again, because you're the chief legal officer for NTA Television Enterprises. Beyond providing publicity, media coverage, what other form, what does this collaboration cover? Because again, he said participants will be going and funding their, trip to Houston and all that. Have you considered other legal implications for this?
Yes, on the legal implications, we have looked at everything broadly, and looking at the age of the participants, they have fall within what we're looking at for the already adults, and nothing will go amiss in that sense. Other things that will come in, they have already paid for their trip, and there's nothing else except that we're looking out for other authorizations, like from Foreign Affairs, to help us out with some of the other things we want to do, and it will go perfectly well. It will go perfectly well.
What's the projected size of attendance?
We're looking at about 140 participants, that's the vendors, and over 600 people attending the trade show.
Oh, that's quite interesting. But it looks like we're dealing essentially here with MSMEs. Is that the case?
Yes, MSMEs.
Okay. But of course, when you do come back, we hope that there will be, great lessons learned, and then, of course, projection of your capabilities and all that. But just give us an insight very quickly. If the agro-allied products, what is the attraction for the market out there? What are they yearning for in terms of agro-allied products from Nigeria?
Oh, so many stuff. Every of our food, especially the swallows, they're yearning for them. Our palm oil, which is probably the best in the world, and it gives me concern when I go to shelves in the US and I see made in Ghana palm oil when we have the best, and so what we want to do is help to take off those other African countries' products and place Nigerian product on those shelves. So there are so many
swallows. Which are the swallows now? I mean, they just
pounded yam.
Sorry?
Gari,
Yes.
yam, flour, maize, all those, apple, cassava, even garments. We didn't even mention the garments. It's very key.
No, you mentioned that earlier.
Yeah,
earlier
they're
on.
making swallows from beans. right now. And so that we're going to showcase. They are very fantastic products.
Amala will also be there.
There's tea, a lot of made in Nigeria tea. There's Tula tea, very healthy products.
Are you going to bring in the Bugadans?
Well, I'm sure they are going there. They know those who are.
Not just the Bugadans, you know. You want to bam bam. There's a song that the Americans used to advertise for police recruitment. It's a Nigerian song.
Yeah, that's in Texas.
Yes, in Texas.
I've seen that.
In Dallas, yes. So we want to show them those artists, you know.
That's good. That's interesting. So Chinedu Amadi, President, Organization of Youth in International Trade and Commerce. We wish you all the best and thank you for coming to share your ideas with us. And good morning, Nigeria.
Thank you.
Also, Barrister Chinwe Osuji, the Chief Legal Officer, NTA Television Enterprise. Thank you very much.
Thank you so much.
And I look forward to also joining you on this
Yes,
trip.
it's a yearly event now, so you can join for the next
Okay, it's a yearly event.
Yes, it will be coming up every year. Yes.
In Houston, Texas. All right.
Houston, Texas.
Thank you very much.
Let's take some sports stories now.
That's Good Morning Nigeria for today, and indeed we wrap it up for the week. As always, we appreciate your tuning in. Monday is another day, 7 o'clock, same time. Enjoy your weekend. I'm Kingsley Ugwu.
And please do join us as always in our campaign against rape and rapists. That way, you too can be a star. I am Claire Adelabu Abdurazak. To have a good weekend.